Welcome to Resource Limitation, a contributor to workplace fatigue. Prepared by Alana Murphy. What is fatigue? Fatigue is the body's response to sleep loss or to prolonged physical or mental exertion. Fatigue can lead to decreased alertness, distraction, poor judgment, and safety-related concerns. A state of fatigue can prevent a person from functioning at their best, both at work and at home. What is workplace fatigue? Stressors caused by a job can lead to mental and physical fatigue in the workplace. There are many factors that contribute to workplace fatigue, dependent on the individual and on their job requirements. Factors include the environment, maintaining a work-life balance, unclear roles between employees, and limited resources available. Resource limitation is a common contributor to workplace fatigue due to the increased stress levels it causes. Workplace resources can refer to sources that an employee uses to do their job well, such as finances, number of employees available, lengths of shifts, hours worked, etc. Lindsay, Hansen, Taylor, and McBurney listed workplace stressors for Australian physiotherapists that included a large caseload and a limited number of staff members. While separate professions, occupational therapists may also work under similar conditions. Therefore, these workplace stressors will also apply to them. Role conflict in the workplace has an effect on fatigue due to the mental strain it creates. This is applicable to OTs, as occupational therapists often hold several roles in a single position. Resource limitations occupational therapists may encounter. First of all, the size of the caseload. A large caseload can be a source of great stress. Having too many clients can leave a therapist feeling stretched at work. This goes hand in hand with the next resource scarcity, which is a lack of OTA or other OTs on staff. One person carrying the workload of 2 or more people can be mentally exhausting. The next resource limitation that occupational therapists may encounter is role clarity. Due to the fact that OTs overlap with several other professions, there can be confusion as to who performs which duties. This can result in an inflated caseload, which we know from earlier is a factor leading to workplace fatigue. Another resource limitation is not having enough time with clients. This can be due to the busy schedule of the therapist, the client, or to an institutional barrier. In a hospital setting, an institutional barrier may include a client being moved to another unit or being discharged. In a private practice setting, an institutional barrier may be that a funding agency only allows a small number of sessions. Both of these institutional barriers limit the amount of therapy that can be received. This leads to the final resource scarcity, which is a lack of funding. The effects of a lack of funding for occupational therapists can include limited equipment, no means by which to run a therapy program, or simply no way for a client to pay for occupational therapy services. So, how does resource scarcity influence the OT? Resource limitation can increase psychological stress and become very mentally draining. It leads to impaired cognitive functioning, which can negatively impact work quality. It is challenging to be productive and satisfied when under a great deal of stress and fatigue at work. So, what can be done in this situation? Resource limitations vary with job setting. Therefore, the solutions will also vary. If applicable to their job setting, occupational therapists can advocate for an increase in staffing, advocate for increased funding, collaborate with and educate clients, families, nurses, teachers, caretakers, etc. to decrease their workload and therefore their stress, strive to maintain a healthy work-life balance to decrease stress, and finally, sleep. While sleep itself cannot solve the issues that arise due to resource limitation, it is a vital tool in mental and physical well-being. To conclude, here is a list of resources, which includes a document from the Government of Alberta on Best Practices Guidelines for Occupational Health and Safety in the Healthcare Industry. There is also a document from Australia which addresses preventing and managing workplace fatigue. These resources are helpful tools and provide more information in this area for those who are interested. Thank you for watching.